So today I'm actually speaking with Dr. Zahra Kassam, who's a radiation oncologist at the Stronach Regional Cancer Centre in Ontario, and she's also an associate professor in the Department of Radiation Oncology at the University of Toronto. Her clinical focus is in gastrointestinal and breast cancers, and she has so many different accomplishments, but she's also co-founded Plant-Based Canada in 2019, which is a nonprofit organization that provides evidence-based education on the benefits of a whole food plant-based nutrition for health and sustainability, as well as planetary well-being. So thank you so much, Dr. Kazan, for joining me today. I know that this is a great topic for a lot of us cancer survivors as well, and we're going to be talking about just so many questions that I get asked through my patients too, and I'm sure your patients, on some of the actions that we can take as cancer survivors, both during and post-treatment. I think it's so important that a lot of us know that what we do can actually make a difference. So thank you again for joining me today.
Thank you so much, Becky, for inviting me. I'm so happy to be here with you and talk about this really important topic. And thank you for all the work that you do.
Thank you so much. So the first question, because we had a whole bunch of questions that we listed out as some of the important topics that we wanted to address today. And the first question today is just sort of all about what can people do to improve outcomes after their cancer diagnosis? I know as a cancer survivor myself, this was such a big area of concern. Is there actions that we can take that could actually help us during treatments?
Absolutely. And as we both know, that's the commonest question we get. What can I do to help myself? What do I eat? And as health professionals in the, allopathic pathway, we don't really get trained in nutrition and lifestyle at all, or if so, very little. And one of the things that I hear a lot is from my patients is it too late? And it
Yes.
absolutely not. So I think this question is really absolutely key, and it's important for us to start talking about it at
Mhm.
at diagnosis onwards. So we know that our lifestyle behaviors absolutely improve our outcomes after a diagnosis of cancer. And we can see that for breast cancer, for example, for bowel cancer. We know that eating a predominantly plant-based diet is very helpful, and not only improving our survival outcomes, but improving our quality of life during treatment. Even in the metastatic setting, we
Yes.
see recent studies coming out showing that eating a whole food plant-based diet can improve fatigue scores, our perception of our cognitive function as well.
Mhm.
And then we also
Mhm.
have very exciting studies coming out around the microbiome, that the more
Yes.
plant foods we eat, we can actually improve our response to treatments. And that
Yes.
we see that in the studies on the systemic treatments like the immune checkpoint blockade agents. So using our
Yeah.
immune system, and even, it doesn't have to be in the setting of the immunotherapy. We
Yeah.
saw a fantastic study. It was a small study a couple of years ago for people who have breast cancer undergoing neoadjuvant chemotherapy, showing that if we had a predominantly plant-based diet and did some exercise, those patients actually had a better response to their chemotherapy. So
Amazing.
it is amazing. So
Yeah.
that's the piece of whole food plant-based nutrition, but there's also other things: exercise, sleep, stress management, avoidance of toxic behaviors. All of these things can impact how we feel, our quality of life, and our survival outcome.
And I think that's so important that you pointed that out, that what we do in terms of actions can make a difference. And starting out with the foundations is basically what we're talking about. We're not talking about anything outside of what we do on a daily basis, which is something
Right.
that's so exciting because those are all things we can control. I know you spoke about the microbiome, and I think it's so exciting because there's more and more research coming out about that. But can you describe what the microbiome is for people that may not really know what that is, and just some benefits that you've seen also in research too?
So the microbiome is microorganisms and their genetic material, and we are actually a meta-organism. We've developed over millennia in symbiosis with microorganisms in the environment.
Mhm.
And when we talk about the microbiome, we generally are talking about the gut microbiome. That's been the best studied, but we have, microorganisms all over our body, in our skin, all our other organs. But if we focus on the gut microbiome, we have trillions of microbes, which are bacteria and viruses and fungi and archaea, that we have outsourced many of our everyday physiological mechanisms out to these microorganisms, such as our absorption and metabolism and peristalsis. And there's increasing recognition that the microbiome is key in the development of our immune system and the functioning of a good immune system. And so that's where we think that the interaction between cancer and the microbiome comes in. There's more data suggesting that what we eat affects the microbiome, that affects our risk of cancer, and it affects our ability to respond to these systemic treatments as well. So it's absolutely key. And when we think about what we eat is absorbed in the small intestine, but some of it gets through to the large bowel. We've got protein residues, fiber, polyphenols, and the gut microbes act on these residues to give these postbiotics. So they're compounds that they secrete, and those compounds are absorbed into the bloodstream and go all around the body and can either have a beneficial effect or a negative effect. And we find that high fiber, plant-rich diets promote gut diversity, which is a good thing, and promote the good bacteria which we want, which then secrete these short chain fatty acids from digesting these fiber residues. And these short chain fatty acids are anti-inflammatory. And we see in those studies that I mentioned that if you're eating plants, you get more short chain fatty acids. Those who have more short chain fatty acids in their stool, in their plasma, seem to be associated with a better response to treatment. So there's a definite interaction. There was an absolutely fascinating study a few years back, which was a collaboration between the University of Pennsylvania and a university in South Africa. And they took 20 US African Americans and 20 people from rural South Africa. They did colonoscopies. They looked at stool and plasma short chain fatty acids, their proliferation rate, the number of polyps, all the things that tell us whether you're high risk for getting colorectal cancer or low risk. And they did these baseline investigations on all of these participants. And the Western diet is obviously that standard American diet, low in fiber, high in saturated fat. And the rural South Africans had this fantastic plant-based diet with 70% from carbohydrates. It was relatively low in saturated fat and protein. And then they switched the diets of these people after 2 weeks and then did all these tests again. And they found that even after just 2 weeks, you completely changed the composition of your microbiome. You had a lower proliferation rate. You had higher short chain fatty acids in the stool and the plasma. You had lower amounts of bacteria that were harmful, the bilophilic bacteria. You had more of the good bacteria. Just having swapped your diet to a plant-based diet after 2 weeks, you can improve your microbiome very, very quickly. And when we think about, how disease develops, it's not just for cancer. The microbiome is felt to be a key player in all of our chronic diseases, and dysbiosis, dysregulation of the microbiome, is associated with multiple different chronic diseases. And we think that microbiome, cellular stress and injury, genetic changes, these are all playing into disease development in the body, causing inflammation, vicious cycle. Again, inflammation makes more of those bad pathways, and this is what manifests in our body as the chronic diseases, including cancer. So microbiome totally key.
Absolutely. And I agree with that 100%. And that research was so interesting too, because I think it just shows that you don't need like years to make a difference, right? It can be a short period of time where we're really hyper focusing. And that keeps extending as we continue to live out that way. So one of the things that I think is really key and important here too is that the quality of life aspect that you're talking about, that people feel better. Not only do they respond to treatment better potentially with these changes, but that people feel better. Can you talk a little bit more about that? Because I think not only is it an issue during treatment, but as you know, even post-treatment, patients have a lot of late effects of treatments or side effects that they're still continuing to deal with. So what strategies are there, key strategies? I know diet, of course, is going to be something that you'll speak on, but that could help to improve that quality of life aspect as well. So side
Absolutely.
effect profile. Mhm.
Yes, and we have studies showing that and exercise and
Yes.
diet does improve quality of life during treatment. Um, we have data using quality of life questionnaires, patient reported outcomes. We have less data in the long term setting,
Mhm.
but there have been some really interesting studies coming out showing, for example, there was a study in a prostate cancer, and they looked at several thousand people who had prostate cancer and who were treated with either surgery or radiation. And we know that these treatments have a lot of long term sequelae, urinary dysfunction, sexual
Mhm.
dysfunction, bowel dysfunction. Um, and also the treatments that cause that general fatigue and
Right.
general lowering of quality of life and wellness. And this study looked at people's diet, and they
Mhm.
looked at their quality of life. And the average time to doing the quality of life after these big treatments was about 7 years. So it's one of the few studies that follow people long term. And they found that the people who were eating a more plant-based diet had better
Mhm.
urinary function, better sexual function, better
Mhm.
measures of vitality. So this is the
Yes.
fatigue aspect that we were talking about, and other general well-being. So what you do can
Mhm.
influence many years later. The most awful feeling we have as health practitioners is saying to our patients, yes, we know you're suffering, but there's nothing we can do. But there is
Yes.
something we can do. Unfortunately, the cancer treatments in general come with sequelae. We
Yeah.
have cardiotoxic chemotherapy and radiation. We can
Mhm.
promote diabetes with some of our treatments, and fatty liver
Yeah.
disease. And all of these, comorbidities, these sequelae of treatment, they all have an impact on our quality of life. And yet
That's
we
right.
know that if we eat well, we exercise, we maintain a good body weight, we sleep well, we address our stress, that helps in all of those diseases. So it's so intertwined, there's so many different layers. So it's not just
Yes.
about the cancer side effects in terms of what they're experiencing from the cancer treatments itself
Mhm.
ongoing, but it's about preventing your second cancer, preventing your other
Yes.
comorbidities as well. And,
Yeah.
unfortunately, if we have one diagnosis of cancer, it doesn't mean we're not going to get a second. And in
Mhm.
fact, there's an increased risk of getting a second cancer diagnosis, and that might be because we're not educating our patients on the lifestyle
Mhm.
factors that contributed to getting the first cancer, in the first place. It's
Right.
multifactorial, we know, but there
Yes.
are things that we can do to improve our lives after our cancer diagnosis and treatment.
I think that's so important to speak on because I always speak about, and the messages that I'm trying to send out to, and I think that you're going to help with is that not only do we have a lot of things that we could be doing, but we also need to understand things better in terms of what types of proactive things we need to do, even post treatments. The first 5 to 10 years, we know that risks are higher for recurrence risk, but we also know that late effects like diabetes risk being higher, thyroid issues coming later on, or other issues for the heart or bone health. All those things are things of cancer survivorship,
Yes,
right? It's from diagnosis on to the end of life, essentially. And how do we reach the best health that we can? And as you spoke about, our lifestyle, what we do on a daily basis, what we eat is so important for all of those things. What do you find would be sort of the top three cancer prevention tips that you would recommend to your patients? I think sometimes people feel overwhelmed.
yes.
They feel overwhelmed because there's so many things that they see online. People are telling them to take this and that, and maybe try to eat this, maybe juice this. So I think if we can just narrow it down to top three things that you could get started on immediately, that will give you sort of the biggest bang for your buck, I guess is the best way to describe it. What would your top three cancer tips be? Prevention tips.
Yes, I think you speak to such an important point. What are people going to do? We can dump a lot of information on them. And so
Yes.
it's going to be different for different people that,
Mhm.
in their lifestyle, they can understand objectively all the important things that we're saying. But, we have most people who are very receptive to that and don't push back, but it's what can you actually do? So
Yeah.
I am going to come to answer your question, but I do
Mhm.
have, I do try and filter out in my discussions with my patients, what is it that you think you can do? Because we are
Yes.
not going to get extra stressed on top of a very stressful time about what we should be doing. So
Mhm.
if you think that the easiest thing for you to do at this moment in your life is to add in 2 extra portions of fruits and vegetables, then that's what we're going to concentrate on.
Yeah.
If for you it's drinking 2 extra glasses of water a day, then that's what we're going to start with. If for you
Mhm.
it's going outside into the sunshine for 10 minutes, that's what we're going to start with.
Yes.
Because each of these lifestyle factors are connected. We
Mm.
just have to start. We have to start with something. Then we feel a
Yeah.
bit better, and then we can add extra things in. So when I talk to my patients, I generally find that just start walking is a really important
Mhm.
thing. Just start walking.
Yes.
You don't have to go to the gym or run a marathon to be
Mhm.
physically active. Just get
Mhm.
outside, start walking. If it's only 5 minutes you feel like doing, just do the 5 minutes, and you'll find that you
Yeah.
do more than that.
Yeah.
And you can do that multiple times a day. You don't have to do 1 hour at one go. So, this idea that you can build slowly, I think, is really
Mhm.
important because that's going to be much more sustainable.
Yeah.
So, if I find out with my patients that that seems to be the thing that they can do, we'll just concentrate on making some
Yes.
calls about that. And so that's the kind of exercise piece. The second
Mhm.
piece is the nutrition. And nutrition, I actually
Mhm.
think, is the most important. So even though I
Yes.
put it second, I think it's the most important. So I talk
Mhm.
about what their food is, we figure out what their baseline is, and then we decide on what to do. So
Yeah.
I talk about variety, eating the foods you like. So these are not really stressful things to do. Just figure out
Yeah.
the fruits and vegetables, whole grains,
Mhm.
legumes, beans, lentils, chickpeas, nuts, and seeds. Just write them all down, figure out what you
Yeah.
like, and just
Yeah.
increase that in your diet. And we
Right.
want variety. We want most of your diet to be from plant foods, and we want to
Mhm.
reduce your animal foods, especially red meat and processed meat, which our guidelines
Yes.
tell us exactly minimize or avoid. So if we
Yes.
take the principle that 85% of your diet really should be from plant foods
Mhm.
and less than 15% from animal foods, let's see where you are now, and let's see where we can add those things in that you like to get you to
Mhm.
that goal. So eating more fruits and vegetables, I tell people to include mushrooms in their diet. On my patients
Yes.
are
Yeah.
mainly patients with breast cancer, so the anti
Mhm.
the mushroom studies show lower risk of breast cancer. Tell them to add in
Mhm.
cruciferous vegetables, which have anti-cancer
Yeah.
properties. Everyone likes cruciferous vegetables, it seems. So
Exactly.
they're so powerful.
Yeah.
I tell them to add in flax seeds,
Mhm.
coffee and green tea, and
Mhm.
soy products. And these are going to have benefits across the board, whatever type of cancer you have. So
Perfect.
pick those, start increasing them. So these are really my top things that I focus on. And I also tell people you have to prioritize yourself. We know that people don't prioritize themselves. They're so busy, they're taking
Yes.
care of their children, their parents. And we know as well that unfortunately diagnoses are happening at earlier ages.
Mhm.
Cancer is increasing in our under 50-year-olds, the sandwich
Yes.
generation who are taking care of everybody else, not themselves.
Mhm.
So I ask them to think about your life. What are your stresses? What are things that make you happy? And see how we can manage that. So just starting to reflect. So a bit of
Yeah.
activity, looking at your diet, and start reflecting on what nourishes you and what helps you make you feel good and do.
I love all of that because I think you touch on all of the building the foundation again and moving from there, and doing it in a pace that you can actually handle and do. Everyone has these big goals, and some people might have bigger goals than other people, but really, it's all about the actual steps we take. And so, thank you for that because I think that's really encouraging for a lot of people. Like, even that little walk that you do can make a difference to how you feel. It doesn't have to be a marathon. It doesn't have to be these like crazy weights and all that type of stuff that you get started on.
That's
Um,
right. And when
yeah.
you do your 10 minutes walking, you feel better. Maybe you sleep
Yes.
better. Maybe because you
Yeah.
slept better, you can make better food choices the next day. It's just
It's
it's
true.
wonderful. Yeah.
Yeah, and it's like this sort of, thing that you create for yourself. It's a pattern of behaviors that then, bring on new behaviors too. I know you talked about a little bit about processed meats and red meat, or you touched up on it a bit. Can you speak to that a little bit more? Because I think still a lot of people don't actually know that there's any correlation with any of those types of foods with our risk of cancer.
Yes, it's so important. And there was actually a study, a survey in 2022, I think, of people in Toronto and
Uh-huh.
looking at their knowledge and attitudes and behaviors. And when it came to red meat and processed meat, like
Mhm.
about 50% of people were either unaware or skeptical that there was a link to cancer
Mm.
there. So you're right, we need to do a much better job at educating people there. So in
Mhm.
2015, the World Health Organization classified processed meat as a group 1 carcinogen, meaning that
Mhm.
the strength of evidence is such that we know that
Oh,
processed
wow.
meat causes bowel cancer. And since
Right.
then, processed meat has been linked to many other types of cancer as well, including breast cancer, bladder cancer,
Yes.
prostate cancer. The World Health Organization also classified red meat as a
Mhm.
probable carcinogen, a group 2A
Mm.
carcinogen, that meaning that it probably does contribute to bowel cancer, and then
Right.
subsequently it's been linked to other types of cancer as well, just like processed meat. And it's
Mhm.
estimated that about 20% of our bowel cancers are directly caused by processed meat and
Mm.
red meat. And
Right.
we remember that our bowel cancer, one of the fastest increasing in incidence cancer in our under 50-year-olds is
Yes.
bowel cancer. And when we look at the habits of people, there was a
Mhm.
study that came out from the UK just recently showing that it's something, you know, really worrisome, like 30% of meat eaten by people under the
Mm.
age of 40 was processed meat.
Mm.
So
Mhm.
with all these, obesity and eating these carcinogens and reduced physical activity, it's no wonder that cancer is increasing in our younger generation. The World Health Organization is very clear. These are carcinogens. The International Cancer Guidelines have incorporated that evidence into their guidelines. So the World Cancer Research Fund and American Institute of Cancer Research that put out fantastic guidelines.
Right.
Same, they use the words minimize or avoid processed meat and red meat. To just
Yes.
clarify as well, what is red meat? Because many
Mhm.
people don't know that pork is classified as red
Yes.
meat as
It's
well.
because it turns white when you cook it, I think is what one of my patients said. I didn't know. It goes white when you cook it. And so they had no idea it was considered a red meat.
Right,
Yeah.
right.
Mhm.
And so, when we're talking to our patients, we really have to specify that this
Yes.
is included. And I think it's an intentional act by
Act, yeah.
vested interests to promote that, meat from pigs as a more healthy version because it makes
Mm,
white. So I think we have to
right.
be very aware of misinformation around this area. The data is very clear. Red meat and
Yeah,
processed meat are associated with cancer and directly cause cancer. And we have
that's right.
data from Harvard, the Harvard cohorts showing that red meat
Yes.
and processed meat are associated with a particular type of DNA damage in colon cells
Mm,
that is associated with an increased risk of colon cancer. And the more of that damage you have, the more of those red meats and processed meats you eat, the more damage you have, the higher your risk of dying of that cancer after a colon cancer diagnosis. So
mm,
there's more and more data coming out on that. There is no place in a healthy diet for red
yeah.
meat and processed meat. And not
Mhm,
only is it the link between cancer, but as we've discussed the importance of the other chronic diseases, it increases
mhm.
your risk of cardiovascular disease and diabetes
Yes.
and dying early. And so
Mhm,
not only are we worried about those sequelae of treatment that we've talked about, but we
mhm.
also know that having a comorbidity, any comorbidity will increase your risk of getting cancer in the first place. It is a risk factor for getting cancer. So again, another interaction and interplay.
Another layer. Yeah, for sure. Can you repeat that again? Because I think a lot of people don't know that fact either, that your, risk of cancers are higher if you
Yeah,
already have a chronic disease, for
absolutely.
example.
So there are
Mhm,
multiple studies in the recent few years that have come out showing
mhm.
that association, cardiovascular disease, diabetes and the metabolic syndrome, but also
Yes.
other studies suggesting if you have other respiratory diseases or GI diseases, that
Mm,
may increase your risk of cancer. And if we
that's right.
think back to what we said about the underlying causes of all chronic diseases, they are the
Mhm.
common causes, the epigenetic changes and cellular stress, the microbiome. So those three, and
Yes,
they cause that inflammation, which is a central feature of all the chronic diseases. So the pathological features are the same, they just manifest in different ways in
that's
different
right.
people, but also then come together because of the same pathways.
Right. And I think it's important to know that epigenetic changes are actually changes that we can control with the things that we do, right? The
Absolutely.
expression of the genes are changed by what we eat, by how we exercise, by how we lower that stress. And so there are factors that we can control, which is why this conversation is so important. It's not to make people scared, it's to help people feel more empowered with the fact that, now they know that these things might be linked to increased cancer risk, that we have the power to then lower those risks by the things that we do essentially on a daily basis again. The last thing that I wanted to touch upon, because I know we're almost done here, is that soy myth. And I know you spoke about sort of including and making sure that we include some soy sources in our diet, but can you speak to that a little bit more? Because I still get patients coming in who have said, oh, well, somebody told me that I can't have soy. I have breast cancer, I have an estrogen positive cancer. And so, it's going to increase that risk more. Can you speak to that?
Absolutely. Thank you for bringing that up. It's so important.
Yes.
And it is the myth that won't die. And health
Yes.
professionals as well are promoting that same myth too. And
Mhm.
this really came from studies, 2 decades ago in rodents, and
Mhm.
where they were fed, very, very high doses of what would be the equivalent of like 57 cups of edamame beans, for example. We just don't eat
Right.
that much, and we're
Yeah.
not rodents.
Right.
And so that's kind of where it all started. And then these myths about it affects your hormones, it can affect your fertility, it can affect your thyroid function. None of that is true.
Yes.
And the human data, there are a lot of studies in soy and health outcomes. And in
Mhm.
2019, there were two large meta-analyses and reviews that showed that
Mm.
eating soy actually reduced your risk of a number of different types of cancers, including breast cancer, ovarian, gastric, multiple GI cancers as well. And the second meta-analysis showed that it reduces your mortality from cancers as well. So the more soy you
Mm.
eat, the more you reduce your mortality from cancer, including breast cancer. And if we look at the breast cancer specific studies, again, they're showing that if you have a breast cancer diagnosis, people
Mhm.
who eat more, minimally processed soy products have a lower risk of their breast cancer coming back, a lower risk of breast cancer mortality. And
Mhm.
that is true whether you have hormone positive disease or you have hormone negative disease. So there's
Yes.
clearly other factors in soy that reduce cancer risk, and it may be due to the impact on vascular epithelium. There's lots of different thoughts on what that might be, but the bottom
Mhm.
line is minimally processed soy, such as tofu, tempeh, edamame beans,
Mhm.
soybeans, soy milks, are so healthful in the diet to
Mhm.
reduce your risk of cardiovascular disease, potentially reduce your risk of cancer, but certainly, if you have a diagnosis of breast cancer, it is associated with better outcomes. So I make a point to
Mhm.
tell all my patients, do include minimally processed soy products. Don't be afraid. Have,
Yeah.
1 to 2 portions a day. Switch your dairy milk to soy milk. The cancer
Mhm.
guidelines don't say don't have dairy milk, but
Yes.
given that there are studies that show a link between dairy and cancer, strongest in prostate cancer, but there are some studies in breast cancer as well, which I,
That's
I
right.
think are very worrying. Um,
Yeah.
I do suggest to my patients that they switch their dairy milk to soy milk. And
That's right.
part of the reason that dairy milk is not, the guidelines don't say don't have dairy, is because it's associated
Mm.
with the reduced risk of colon cancer, but that's due to the calcium, not the
Exactly.
dairy piece. So as long as you're
Yes.
substituting your dairy for a plant-based milk, which is fortified with calcium, and I think the
Yes.
best one is the soy milk, you're not going to be doing yourself any harm by ditching dairy. And for
Mhm.
me, using the precautionary principle, especially if you've got these hormone driven cancers like prostate cancer and breast cancer, is is to be ultra careful and do that switch. And it's
For
for most
sure.
people, it's not too difficult. And
No. Yeah.
pointing to that fact that you've already mentioned that small changes can make big
Mhm.
differences. You don't have to be 100% with everything. Just, if you're in your cereal, you can switch to soy milk, then that's great.
Mhm.
But you want to keep doing your dairy in your tea because it tastes better. That's okay. But, making small
Yes.
changes, some changes will be beneficial.
For sure. And just to add to that, there are some studies showing that soy products can actually help to reduce some of the hot flashes, either frequency or
Yes,
intensity of it, which is really great
absolutely.
for women who are going through a lot of those symptoms, postmenopausal type symptoms, especially breast cancer survivors. And the other thing I wanted to add on to that was the fact that I think a lot of my patients also are worried, well, yeah, I'm not going to get the calcium, right? I can only get it through dairy products. That's actually not true anymore. If you look at most of the products that are out there now, they're all fortified with calcium and about the same amount as you would get through a dairy milk. So that
Amazing.
concern is no longer there. What I love about soy milk too is it actually has a ton of protein in it. So per cup, you'll get about 7 to 8 grams or so, depending on the brand. Thank you so much for tackling that because I think it's still, as you say, one of those myths that just will not die, and it seems to be ongoing. Interestingly enough, I also had done a high school project on this, and when we look at the studies around soy and soy consumption, the countries that had the highest levels of soy consumption, East Asian countries, actually had the lowest levels of risk for breast cancer or incidences of breast cancer at that time. So, it's really important for us to be able to decipher what's real and what's not real through the studies. Thank you for helping us do that. Thank you so much today, Dr. Kazam, for just speaking on so many points here that I think will help to empower cancer survivors to take meaningful action that we know can be helpful through the research that we see, but also that it doesn't have to be perfect. None of us are perfect, but it's the added benefits of all of these actions that we take that can actually help us overall. So thank you again for joining me. I think this is going to be so beneficial and helpful for so many people out there.
Thank you so much for inviting me. It's been lovely to be with you today.
We'll talk soon, I'm sure.